The stroke in women has been in focus of research in the last year because it was a kind of a neglected area, and I want to focus on risk factors and epidemiology in the different ages and the different age groups. I think it's important to see that young women that take, for example, oral contraceptive, which is quite in use, have a higher risk, 3 to 4 times higher risk of a stroke in this age groups, and stroke in younger is generally increasing. So this is important. And then there is the stroke in pregnancy, which also shows, for example, an increase because of women all get older when they have their first pregnancy and have vascular risk factors. And there's also the risk threefold increase compared to the non-pregnant women. And then in the older women, it's the menopause. And in the menopause, there's a discussion about hormonal treatment. And there is a special vulnerability for hypertension and ischemic stroke. So this is an important risk group too. And in the older women and the very old, because it's now expected that with a general increase in lifetime, there will be in the future more older women, because women getting older than men will have their stroke over 80, and there are several risk profiles like atrial fibrillation that have to be treated too. So these are the risk groups and the epidemiology I will focus on, and then I will go through the different types of epidemiological increase and what we can do about it. And mostly for the hormonal, for the oral contraception group, it's that's in the Western countries, like also the States and the Western countries, with a general increase of metabolic diseases or increase in weight. And the BMI, for example, increases, the physical activity is diminishing, and there are not more smokers, but there are some smokers. And smoking, migraine, and a higher BMI, it's about 7 or 8-fold increased risk of having a stroke. So these are groups that we have to be aware of and have to be also in the focus of research. And the stroke and pregnancy group is important to have be aware of the individual risk profiles of that woman that might suffer a stroke during pregnancy, which is devastating, because it's the largest risk of having a handicap after pregnancy is actually having a stroke during pregnancy, and it's not just during pregnancy, but it's also after the post-partum period, because of the viscosity or the hypercoagulability and the higher risk of venous vein thrombosis. And what we observe is up to 6 months after delivery, an increased risk of having a stroke. So what are you doing with this woman? And then there are the other focus is the guidelines and the recommendations, and the third part would be what you can do to have more women randomized controlled trials, or having more evidence, because the group of the women with pregnancy has been excluded from all randomized controlled trials, and therefore we don't have the evidence for all the acute treatments and other medicines because they were excluded actually.